Our next presenter is from the School of Computing, Engineering and Mathematics. It's Dr. Quang Vinh Nguyen. And the topic of the presentation is Enabling Effective Clinical Decisions with Data Analytics. Thanks very much, Quang.
Thank you. Good afternoon, everyone. My name is Vinh. Today, I'm very honored to present. In Australia, there are 650 kids has been diagnosed with cancer every year. Together, there are over 200,000 children have been diagnosed with cancer worldwide. And this is a very big number that we have been facing. And thanks to the growth of the technologies and the research discoveries we have been done, the cure rate has been improved dramatically for the last 30 years. But my dream and our dream, no children should die because of the disease. Clinical, the research questions we always ask, how can we make a treatment safer, less toxic, and more accurate for the children? The clinical methods that we have been used so far was great. However, alone, they might not suitable enough to treat, to deal with the patient. That's because the patients may act or may perform differently based on the different methods or different clinical treatments that we have. So that really motivates my research. What we try to do is we try to utilize the state-of-the-art technologies in big data analytics together with this user-centric interactive visualization to break out the complexity of the genomics data. And from that, we can make the data easier, more accessible to the clinician. And with the foundation they have learned, they should be able to decide to make a better treatment based on a particular type of the case. And again, the genomic data that we have is really complex. It's much more complex than the word cloud that I put on the screen that you can see regarding about my research keyword. And this research has been carried on for many years, involving the expertise from many researchers on different disciplines, from Western Sydney University, in West Children's Hospital at Westmead, University of Technology in Sydney, Queen University in Canada, and many, many more. And this is a long journey that we have been done, and we have made some successful along the case that we have in our research. We've been able to generate the visual analytics with tools to support a decision making where for breaking out the medical data set in a very complex form to a simplified form. This is one example that the work that we have been done where we apply to acute lymphoblastic leukemia. As you can see, we be able to verify very big theories that the gene actually is the main contributor to determine whether a patient is likely to survive or not because of the disease. As you can see in the group, the top one who are survived and the bottom who are the bottom one who are survived and the bottom group, they are not survived. And the place of the genes contribute where they are on the screen. And we further go and analyze further, and we be able to verify the theories that no gene actually contribute or the sole factors to the disease. And the research still a long way to go, but we have made a certain of successful. We have the research has been awarded by the New South Wales Research Institute at the gala dinner for the outstanding researchers in 2015 and 2016 for the Big Data, Big Impact grant, together with the support from Oracle to boost the research further. So the long term that we try to do is we try to make a bigger impact. We try to utilize the expertise from various disciplines, from medical doctors, from the cancer researchers, from the data mining people, from machine learning people, from the visual analytics. And from that, we hope we can make a bigger impact and a bigger output. And the team I just put there was the winning teams in the gala dinners. Thank you very much.
Thank you very much, Nguyen. And a question from the panel.
Thank you. Could you just let us know the response you've received from the broad medical practitioner community? You know, how do they feel about using the big data analytics?
We actually, we work very close side by side with the medical doctors who actually contribute their knowledge as well as their comment and feedback during the development stage. The one I discussed where we be able to deliver the tool and the software for them, so they will be able to verify the theory and the discovery based on their practicals. At this stage, we have not yet put out to the trial or to very detailed in the clinical, but that will be the future work that we hope we can bring out in the next few years.
Thank you very much, Quang.